Good morning, everybody. This is Dr. Mesa, board certified plastic surgeon in New York, yes, in Miami. Today it's time to do cases under local anesthesia. Today we're going to do a bunch of different cases of plastic surgery. We're going to start with a mold removal, then we're going to do with skin tightening of the neck with just Morpheus8, then we're going to be doing a little bit of Accutite and skin tightening, and then we're going to finish the day with an eyelid surgery. And all those procedures are going to be done under local anesthesia. Want to see how I do them with local anesthesia without any pain? Let's watch the next videos. Is this patient candidate for a skin mold removal? Let's find out. What are the goals of the patient? She said, Dr. Mesa, I was born with this mold. It has been all my life in my face. It's not growing, but I hate it. When I'm in pictures, I don't like it. Sometimes I have to do Photoshop. I feel self-conscious. I want to take it out. Do you think you can do it for me? And I said, yes, absolutely. So as you can see here, she has a mold very close to the eye, and it's a little bit in the bigger size. It's not very small, so that one requires a special surgery. Why? Because if I just cut it out and try to close it, she's not going to have a good scar. So we need to do a special plastic surgery. So what do we need to do? We need to do like an incision that looks like a little eye or an oval appearance. Why? Because once I remove this area, the wound, the surgical wound, I'm going to close it and it's going to end up with a very fine scar. And because it's placed at the level of the wrinkles of the face, it's going to be imperceptible. How I'm going to do this procedure? As always, on the local anesthesia, completely awake and without any pain. Do you want to see it? Let's watch it.
Viewer discretion is advised.
Okay, so we are done. You see, with patients that when you have like a mole in the skin, especially on the face, that you don't like it, it's very simple. It has to be removed on the local anesthesia. It leaves a teeny tiny mark, but then it's going to be fade in about 3 months. And on the local anesthesia, you can come get the procedure done, and then you leave by yourself. No extra requirements. Now let's do another procedure that is going to be skin tightening. Is this patient candidate for improvement of her neck wrinkles with plastic surgery? Let's find out. What are the concerns of the patient? She says, Dr. Mesa, I'm in my 20s, but I have my neck that makes me look very old. As you can see here in this angle, I have significant wrinkles, and in this area, I look really wrinkled. My neck looks like I'm in the 50s, and I'm only in my 20s. What can you do to improve that area? And I say, okay, we need to analyze what is going on. As you can see here, the patient has significant wrinkles in the anterior portion of the neck and in this area, but nothing underneath the chin. Also, we notice that the neck is not that really fat, and the muscle is still intact because she has an amazing shape of the neck. So the only problem in this case is the skin. So therefore, the only treatment that we can do is a skin tightening. Because she has black skin, we cannot do a laser because it's going to make the skin darker. And of course, a chemical peel is going to be horrible for her because it's going to do changes in the skin. What do we need to do? Radio frequency based skin tightening. In this case, what we need to do is we need to do Morpheus8. That is a device that is going to produce a skin tightening and decreases discoloration or hyperpigmentation in patients with black skin. How are we going to do the Morpheus8 in the neck? As always, on the local anesthesia, completely awake and without any pain. Don't you believe me? Let's watch the next video.
Viewer discretion is advised.
Okay, so we are done with our case of Morpheus8. You see, for patients that are very young, that they have a little skin laxity and they are not candidates for a neck lift or any other invasive procedure, the best way to tighten the skin is with Morpheus8. And because you see, I did a very intensive course of Morpheus8 on the local anesthesia, she felt zero pain. So now let's do another procedure that's going to be another tightening, but with Accutite. Let's do it. Is this patient candidate for spot treatment of an area of a skin that has laxity after a facelift? Let's find out. What are the goals of the patient? She said, Dr. Mesa, I got a mini facelift. I'm very happy with the result, but in this area close to the corner of the mouth, I have a little bit of laxity, and I want to kind of tighten that area, and I don't want to get a second facelift. Do you think you can do one of those machines that does miracle work? And I said, yes, absolutely. So in this area, what is the problem? The problem is the patient has a little bit of laxity and a little bit of fat that doesn't require surgical management. She only requires minimal management. So in this case, we're going to do Accutite. What? Because in this area, we can do with the machine. The Accutite is a device that goes under the skin, heats up the tissues, and produces skin tightening enough to produce the tightening that she wants. How we're going to do it? We're going to do a little opening here in the level of the jawline, and I'm going to do Accutite in this area. And on top of that, I'm going to do Morpheus8 in 2 modalities, in the superficial to tighten the skin, and then deep to decrease a little bit of the fullness that she has in that area. How I'm going to do these procedures? As always, on the local anesthesia, completely awake and without any pain. Want to see how I do it? Let's watch it.
Viewer discretion is advised.
Okay, so we are done with our case. You see, for patients that want minimal skin tightening, like a very small areas around the mouth, you don't have to do a full facelift, you don't have to do a full face tight or neck tight. You need just a small application of Accutite with a little bit of Morpheus, and in that area you get like a really nice reduction with minimal downtime. She's going to be swollen for a couple of days, but then she's going to look amazing, and we're going to see her results in about 3 to 4 months. So now let's do the last surgery of the day, eyelid surgery. Is this patient candidate for upper eyelid surgery revision? Let's find out. What are the concerns of the patient? She said, Dr. Mesa, I got a upper eyelid surgery or upper eyelid lift several years ago, and I started to have a little bit of excessive skin in the upper eyelid, especially in this lateral portion. Do you think you can do another upper eyelid surgery? And I said, of course we can do it. So what is going to be the plan? As you can see, she has a little bit of excessive skin in this area, so we need to remove it. In what way? We're going to do an incision at the level of the crease, and we're going to remove all the excess of skin that is hanging in that area. How much is the skin? When she's opening, we cannot see too much, but it's when she closes the eyelid, you can see all the excess of skin that we need to remove. In that way, she's going to have a more youthful appearance, contour, and she's not going to have any more the hooding of the excess of skin that she has in the upper lips. How I'm going to do the procedures? As always, on the local anesthesia, without putting her to go to sleep, awake and without any pain. Do you want to see how I do it? Let's watch it.
Viewer discretion is advised.
Okay, so we are done with our surgery. So upper eyelid surgery can be done completely awake with the patient under local anesthesia without any pain. You see, I love this kind of surgery because I'm talking to the patient. I don't have to look at the monitor. If the patient is talking to me, the patient is totally fine. And she is beautiful. You know, right now she's going to get it over. She's going to get back home. I hope you like the surgeries that we did today. See you tomorrow with more procedures. Bye-bye.